up the road. I have my own clinic in there. It's called Injectables BH, and today I'm just going to give you a little bit of a rundown on what aesthetic medicine is today, what it was, what we're aiming towards, and just a little background on all the new things that have come on the market. So traditionally, we've always thought of aesthetic medicine as just Botox and filler, really. And a lot of people sort of think about the look of celebrities, people from the early 2000s, where you were overfilled, you were puffy, everyone's face looked quite different to who they really were, and really stiff frozen faces from Botox. And I think unfortunately that sort of has carried through a little bit. In the last few years, there's been a real step away from not looking like yourself to people looking like themselves and just really rejuvenated, just refreshed. So Botox now, or any anti-wrinkle neuromodulators is what we call them, is to help smooth the lines, the fine lines, and help make the deeper lines a little bit more refreshed and less deep. Filler still has its place. I think it's beautiful on the lips. I think there are certain groups of people that can certainly benefit from it. So someone who's lost a really large amount of weight, people that have been through chemo, where a lot of your fat cells have now melted away, we can certainly use that in certain areas like the cheeks and the chin. However, the huge step that we're moving towards now is regenerative medicine, and there are two big players in this. There's biostimulators and bioregenerators. So now we're going from filling to more healing your own skin, having your skin do what it should be doing. So from the age of 20, we sort of stop building collagen, and once you sort of hit perimenopause, menopause, what little you have left starts getting destroyed by your own body. It's just like a gift that keeps on giving. So what we have now are biostimulators like Sunicos and Profilo and Skinvive. We have things that have PLLA in it, what we call Kaha. They go back into the skin and they trigger your cells to rebuild their own collagen and elastin. So everything that is being destroyed, these go back in and trigger them to be rebuilt. The biggest ones are collagen 4, 7, 11. We don't make those naturally in our body. So these go in and say, start building them. So we have the ability, we just don't do it. So the focus is really collagen induction, tissue repair, and cellular signaling. And the cellular signaling is where we put these into the skin and it signals the cells and says, start building them again. So one of the things that I always stress to all my clients is this is the long game. So where you would have got filler, you would immediately see a change in the cheeks and the lips and the chin. These will take weeks to months to work. But the good thing is that they're working. They're causing your own skin and your own body to start rebuilding what you need, and you're getting longevity. So where filler will be eaten up in 12 months and you start all over again, these are still working, and all you have to do is maintain them every 6 to 12 months. Depends on your skin, depends on your body, depends on your metabolism. So some people will come back 6 monthly, some will come back 12 monthly to do it. So biostimulators are actually go in there and they activate your own fibroblasts. Now, elastin is what keeps your skin stretchy. So when you get that crepey skin, and that sagging, that's due to loss of laxity. Your collagen is what helps keep everything plump, and it helps to keep everything up where it should be. Your extracellular matrix is actually all these things that are under your skin. So if you think of your skin, it's teeny, 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 tiny, but there's actually layers and layers and layers of things that are in there. So the two main things are called Kaha, we just call them Kaha and PLLA for short. These have been put into a lot of these biostimulators where we inject directly into the skin and they work in the matrix. So where you have your dermis, your epidermis, your dermis and your hypodermis, if we think of this is actually your skin. So when you skin yourself and a little bit comes off, this is actually what that whole thing is. And so if you're looking at a skin that has wrinkles on it, the matrix in it, which is this area, as you can see, there's a lot of things that are missing through it. Whereas in here in the healthier skin, there's a lot more of this collagen, elastin in that matrix. So we're targeting this area. So where your neuromodulators, we would do deep in and we would get it into this muscle pad to keep it from wrinkling. These work in here. So we do it in combination with. So I would say if you do Botox, then this is something else to help with it. So this is what they look like. This is Sunakos, that's Profilo. They are both hyaluronic-based biostimulators. Now, these work slightly differently. This one here is hyaluronic, high-low molecular weight. What that just means is one works under the surface of your skin, one goes deeper into that matrix. Sunakos is also hyaluronic based, but it also comes with essential amino acids that our body and skin needs to stay sort of firm and hydrated. So this goes in there along with the signaling and it helps to rebuild it. So if you think of when you build a house, these are the foundations. They're going in there and they're reinforcing it. Then you've got Radiescent Skin Weave. This is the Kaha product that we're talking about. This one comes in with one tiny syringe like that, and it is put usually in the jaw area, but it can be put in other areas. What Radies will do is it will give you immediate volume, but also works for 12 to 18 months to continue to deliver everything you need to rebuild collagen and elastin. The others will not give you volume, so they will not change your face at all. The volume that you get from this is very minimal, so don't think filler, think quite minimal, but it does have long-term effects with it. Skin Weave is something that comes with glycerol, hyaluronic acid, again, hyaluronic based, they all are. But this one here is really for just hydration, and we use it on the lips as well. So somebody comes in and says, I don't want lip filler because I don't want that big lip look, but I want them hydrated and I want the very, very, very minimal amount of sort of volume in there, then we would use something like Skin Weave. They're very safe, they're hyaluronic acid like I said, so they're quite natural. This one has slight cross-linking, which basically means that the hyaluronic acid comes in more of a gel form as opposed to a very runny form that you would get with things like Profilo and Sunakos, who are very liquid. And they're like that because we want to inject them and have them run through the face. All of these help with fine lines and wrinkles. Again, it depends on the customer and the patient. If I have somebody who is, say, 60 years old, has done a lot of sunbathing, has got a lot of lines, they're not going to get the same results as, say, a 45-year-old who wears sunscreen all the time and has maintained good skincare. It's not to say they can't use it, but your results will vary with them. So the lasting effects can go up to 2 years with them, which I think is actually really good given the cost that you pay nowadays for this sort of thing. You can use most of these for the face, the neck, the décolletage, and the body. So some people use it in the stomach, in the arms. Your top three really are your face, your neck, and décolletage, to be honest. And that's just for rejuvenation. So they don't replace volume. They're all hyaluronic based. They do have amino acids in them. Sunakos in particular, we use a lot for under eye rejuvenation. I've got some handouts and forms there. Have a look through them. They do give some New Zealand studies, which is actually really good because it's not overseas people. These are people that have worked with the company, for the company, or have been patients of the company. And it helps with fine lines, crepey skin, and texture. So anybody who gets texture under eyes, helps with a little bit of volume loss, not so much. Once you're getting hydration in there, it helps with that. You have Profilo, again, hyaluronic based. It gives it what we call a hydro lift. So it's not a lifting effect, not like you're going to get with a facelift, but certainly it does help in the cheek area to cause a bit of a lift in there and in the jawline. SkinVive is the one that I was talking about, where we can put in the lips, more for dewiness, more for cheek roughness, that sort of thing. Lovely on the lips. Minimal downtime with all of these. I have people that go back to work either immediately or by the next day. So Sunakos, I would say do it at the end of the day. You can go back to work the next day. The others, you can virtually go back straight away. Radies is what we call a Kaha biostimulator. So like I said, there's PLLA, which is very good for somebody that's a little bit older. It can last for up to 2 years, but you have to really research who does it for you. They cannot be dissolved. So once somebody does it and you get a nodule, the nodule can never be dissolved. This one is a little bit more friendly. It gives you a firmer dermal matrix. It does help with a lifting effect. It's mostly for skin tightening. Somebody who's got a lot of laxity sort of down here, which women of a certain age do, it helps with that sort of thing. This is just comparing the top products. Of course, there's many products out there. These are the top ones that I've researched that I deal with personally. Not to say there isn't others out there that are great. It's just what I've searched, what I've studied through clinical papers and through trainings that I found to be the top ones. So you've got your Radies, which is your biostimulator, Profilo, I put those in the same category. I sort of recommend it depending on the patient and what they're looking for. And then there's SkinVive, which is probably what I would start somebody who's a beginner on. You can certainly layer them, so they're not just one. Some people will have 2 different things. So if you said, oh, I really want structural hydration and remodeling, then I would say those are your 2. Under eye treatment, I would do a Sunakos, and in the cheeks, we would do SkinVive. So they can all be used together. One treatment that's not so much an injectable, but certainly still uses needles, is microneedling. Now, microneedling is incredibly underrated in this industry. It's been around for a really long time. Back in the day, the needles they used were quite sore. They were a little bit bigger than they should have been, but I mean, technology just improved all of it. Nowadays, people don't even feel it. Amazing for collagen induction. Incredible for it. And if you wanted to choose 2 things to do, say you're on a budget, say you don't want to do too much to your skin, I would say do your Botox and microneedling. They're amazing. It is a natural way of causing small little micro punches in the skin that activates the skin to rebuild its own collagen. And it helps with tightening, helps with pore reduction. It's incredible. And for what you pay for it, it's cheaper than doing the biostimulators, but it's really underrated and I highly would recommend it. I have a lot of customers who will do Sunakos and Profilo and then come back in 6 weeks and do microneedling. The reason is it reactivates that collagen induction. I do like a package deal, so you're not paying full price for it, but it's incredible. Wherever you go, I would say this is a really good treatment to have. The biggest thing I would say is make sure it's a medical professional who does your treatments for you. I know there's some people out there that are not fully trained in a lot of these things. I didn't actually realize you could do it, but apparently some do. The reason is, like I said, with something like Sculptura, which is PLLA, if somebody doesn't do it correctly and you get a bolus, if it was filler, we just dissolve it. You would come in, we actually find the nodule and we dissolve it straight away. If it's something else, it goes away. So one of the things is if they don't do your brow properly with Botox, you can get ptosis, which just means your eyelid comes down a bit. There's a drop and it makes it go away within days. But if they're not professionals who don't know any of this, A, they won't be able to help you, and B, something like Sculptura can't be dissolved. It will just sit there. So do your research when you're looking for people. And really ask as many questions as you want. Don't be afraid to ask. They're expensive, but worth it. I really think that they are. So you should get the best you can from the medical professional. Now, anti-wrinkle, which is the golden standard, she's the queen of everything in aesthetics, is Botox, Xeomin, Dysport, let's just call it neuromodulators, basically anti-wrinkle treatments. The way that they work is this whole big blah blah at the top is it signals your muscles to relax. So there's a communication between your nerves and your muscles, and it says to them, stop doing what you're doing. The reason is, when we have repeated movement in the Pharm, or we squint a lot, we get these lines continuously. So it's not your skin, it's actually the muscle that causes that fold. And the more we do it, the deeper those folds become over time. So what neuromodulators do is we target that particular muscle in that area, and it only works in that area. So it's not going to go into your nerve cells around your face. It's not going to freeze the whole face, just that one area. And we target that area to stop so that you can get smoothness forming. So if you're younger and you have a fine line, it'll probably disappear. If you're a bit older and the lines are established, it will take a few, but it will definitely smooth it out as much as we can. Again, this is where later microneedling helps with it as well. Frown lines, forehead, crow's feet, bunny lines are probably the most popular we do. Bunny lines are these ones here. Gummy lines, people that smile and get quite a lot of gum showing, we just put 1 unit here, 1 unit here. Masseter muscles, which they say jaw slimming, I actually think it's really good for bruxism, which is people that grind their teeth in the night. So basically what we're trying to do here, and what my main aim is not to have you look frozen. I like people to be able to still move. And my aim at the end of the day is not, oh, you've had Botox, so it's, oh, you're looking quite refreshed, sort of a look. So I always start with a standard dose. I never do mini doses. Now, mini doses or baby Botox is something that is certainly out there. I don't like it for 2 reasons. One, that's not actually the dose that they've studied for it to be effective. 2, you end up coming back sooner to have more done. So in the long run, A, it's more expensive, and B, you're being exposed to the toxin more. And we don't want that, because we don't want your muscles to get used to it and your body to develop immunity to it. So once you're immune, it takes 5 years for your body to forget that. So that means if you're 40, it'll be like 45. If you're 45 until 50, you can't really, I mean, you can get it, but it just won't work. Your body will recognize it as an antigen and just metabolize it out. So it's a waste of money. So with this, you're looking at sort of 3 to 4 times a year. It's actually not that much when you look at it in the wider picture. Anybody over the age of 18 can use it. Obviously, I wouldn't even do anybody until they're in their 20s. Some people do it in their 20s as preventative. So I have a friend whose family all have a really deep line that runs through there because they all frown. Not that they're angry people, they just do it when they concentrate, they do it when they're looking at their phone or whatever. So she was like, absolutely not. So at 25, she started. She's the only one that doesn't have it. She started Botoxing. She's in her 40s now. But so people can use it preventatively, or they can use it to treat what they already have. It's very quick. You're looking at sort of 10 minutes. Minimal downtime. The only thing would be if you bruise easy, which people with like me who are like fair, blonde, blue-eyed were more likely to bruise than somebody who's got sort of more olive skin. Not to say they won't, but that would be the biggest thing. The results are quite predictable. We know what's going to happen because we do it all the time. So if somebody comes in and complains about sort of their eyebrow dropping, we wouldn't do their forehead. We would actually do their frown line, which sounds weird, but that's actually the one that controls this area. Once you do the forehead, you actually have more of a dropping effect. So, you know, we know what your results are going to be. It can take from day 3 to day 7 for it to kick in. Most people feel by day 3 it's worked. By the 2-week mark, that's your final result. It's fully worked. We know that's your end result. We get you to come back, and if there's any touch-ups you need, we do your touch-ups for you. If you stick to what I have recommended to you the first time, when you come back in 2 weeks and you think, oh, I need a few more units and I need to fix this and that, it's complimentary, because I'm quite confident that we're going to do it right the first time. But I don't charge people for just touch-ups for it. And then that's it for another 3 to 4 months. So that's really it with this whole thing. My philosophy, and I think the philosophy of a lot of people in the industry now, is don't overfill, have people look like they look. We just want you to look refreshed, rejuvenated, and we want you to feel confident in your skin. I think at the end of the day, aging is a privilege that we all get, but some people just want to slow down the process, and I think that's what regenerative medicine really is. It's just about slowing it down. You're just going to look better in your 40s, in your 50s, in your 60s. I have people in their 70s who come to me, and one of them, she's got amazing skin, like better than some of my 45-year-olds that come in. So I think it's a package sort of thing. Obviously, you have to maintain your skin. You have to have good skincare too. But I don't think you need to spend the world on that. I think there are so many good things out there. There's La Roche, there's Korean skincare. I mean, if you want to get the more expensive stuff, by all means, but I think it's like getting your hair done and dyed at a really lovely expensive salon and then never washing it again, sort of thing, you know, like, so I think it is something you have to maintain. A lot of these biostimulators and regenerators will have a bigger cost up front, but their annual maintenance is actually a lot cheaper. You're looking at like a third of the price, not even half, like minimal. I have got brochures, feel free to take them and have a look. They're just over there, I haven't put them out yet. But if you have any questions, my number's on there. I'm happy to just answer questions. I don't charge for consultations. So you can just come in and ask me questions about products, about procedures, about anything, and I'm happy to do that for you. Yeah. Thank you. Any questions anybody has?
Yeah, well, what's a nodule?
A nodule is like a bump.
Okay.
It's just like a round ball that forms. So when you have filler sometimes, the way we do filler is we put the needle in and we call it retrograding. So we start pushing the needle in as we pull out, and it's a thread. But sometimes when you do it with certain products, the first pump that you do as you pull out will just be a little bump. So what we'll then do is we massage it out and we sort of massage that whole area. However, if that's not massaged properly, if it's a bigger bolus than we wanted, then it just becomes a lump under there. And you find people that have had lip filler sort of continuously one after another, right under what we call the wet border, where you know your lip goes wet, so there's your dry part and then the wet part, you get these lumps that form in there. Those are just filler nodules, and they're hyaluronic acid. They're really easily dissolved. We literally just put a needle in there and just push on hyaluronic and it's gone. But certain things like PLLA, which is like a plastic, doesn't, it stays. But Kaha is calcium based, it's like your bone. So that's, yeah, slightly different.
I have a question.
Yes.
Thank you for the presentation.
Sure.
On the microneedling, for someone like I had a lot of cysts, especially around my chin.
Sure.
And I have some scars as well. So
Sure.
I was thinking, I like the idea.
Yes.
But then I'm a bit stressing on the thing. Can it
That's actually a very good
cyst?
point. So people that get keloid scarring, most of us when we scar, the scar actually goes away. Some people get keloid scarring, which means that scar turns into a thick tissue and it doesn't go. Those people are not candidates for microneedling, unfortunately. So cysts might actually be okay, and I would get that checked with the doctor first. But if you have keloid scarring, so where your scars will turn into scar tissue underneath, then you wouldn't be a candidate for it, unfortunately. Yes, that's one. In fact, I think that's the only really big one there. Yeah, unfortunately. But we do, with the microneedling, I always put a solution over the top as well, which is a peptide that's included in the whole process. So if you ever have it done, see if they can do that for you. It helps with the healing and your final results.
Any other questions?
Excuse me.
Yes.
The Kaha-based injectables, would you do it on somebody who's on blood thinners? Like bruising something?
Depends on what you're on. If you're on warfarin, for example, we would probably proceed with caution because you will get quite a bit of bruising. But if it's aspirin and it's a daily dose, you certainly can still do it, but we would just say, look, you're probably going to get bleeding and bruising from it. And in fact, with every injectable, that's the case. So there's steps. So warfarin's probably your highest, and then aspirin's a very standard one that most people are on, to be honest. I have people on aspirin who get their injectables done, and very seldom do they actually bruise. But with the kaha, it's probably a bit more invasive, so you may find that you'll get bruising, yes.